Welcome to Shah Medical Surgical. Today, we will learn how to give first aid to accident victims. Before going to video, please like, share and subscribe. Traffic accidents are sudden and often life-threatening. In these critical moments, your actions can make a significant difference. This guide will walk you through how to respond to various situations when someone is hit by a car, including head injuries, spinal injuries, broken legs, and other emergencies. Let's begin. First, always ensure the accident scene is safe. If there's oncoming traffic or other hazards, prioritize your safety first. Call emergency services immediately and provide them with precise details of the location and the condition of the injured person. Avoid moving the victim unless absolutely necessary, as this can aggravate their injuries. Check if they are breathing and conscious, and provide reassurance while waiting for help to arrive. When dealing with head injuries, it's essential to act cautiously. Look for visible signs such as bleeding, swelling, or bruises. If the person is confused, unconscious, or vomiting, these could be signs of a serious brain injury. Keep them still and lying flat to avoid further harm. Apply gentle pressure to any bleeding wounds using a clean cloth, but never press too hard. Do not give them anything to eat or drink, and stay with them until professional help arrives. Spinal injuries are particularly delicate. If the victim complains of severe neck or back pain, or if they show signs of numbness or loss of movement, it's crucial to assume a spinal injury. Do not attempt to move them unless their life is in immediate danger. Ensure their head, neck, and back are kept in a straight line. Support their neck gently and keep them as calm as possible until paramedics arrive. For leg fractures, signs may include swelling, bruising, or an obvious deformity. The injured leg might look shorter or bent unnaturally. Immobilize the leg by using a splint or any sturdy object like a stick or rolled newspaper. Wrap the splint with cloth to secure it without causing pain. Control any bleeding by applying pressure with a clean dressing, and elevate the leg slightly if it doesn't cause discomfort. Chest injuries can be life-threatening because they may affect breathing. If the person has difficulty breathing, severe chest pain, or visible wounds, act quickly. Sit them in a semi-upright position if they are comfortable, and cover open wounds with a sterile dressing. Avoid pressing on their chest, as this can worsen the injury. Keep monitoring their breathing and be prepared to perform CPR if they stop breathing. Abdominal injuries are often very painful and may indicate internal damage. Look for swelling, bruising, or visible wounds. If organs are protruding, do not try to push them back in. Instead, cover the area with a clean, moist cloth. Do not allow the victim to eat or drink, as this can complicate surgery if required. Keep the person calm and ensure they receive immediate medical care. Severe bleeding requires quick and decisive action. Apply firm, consistent pressure to the wound using a clean cloth or bandage. If blood soaks through the material, add more layers on top without removing the original bandage. Elevate the injured area above heart level if possible, to slow the bleeding. Always call for emergency help as severe blood loss can lead to shock. Burn injuries need to be treated with care. For minor burns, rinse the area under cool running water for at least 10 minutes. Do not apply ice, creams, or ointments. For severe burns, loosely cover the area with a sterile, non-stick dressing. Avoid breaking blisters or removing charred clothing stuck to the skin. Seek medical assistance immediately for any burns that are extensive or involve critical areas like the face, hands, or joints. Shock is a common but dangerous condition that can follow severe injuries. Signs include cold, clammy skin, rapid breathing, a weak pulse, and confusion. If you suspect shock, lay the person down and elevate their legs slightly unless there are injuries preventing this. Keep them warm by covering them with a blanket or coat. Reassure them and avoid leaving them alone until help arrives. If the victim is unconscious, check if they are breathing and have a pulse. If they are breathing, carefully place them in the recovery position to keep their airway clear. If they're not breathing, begin CPR immediately and continue until professional help takes over. Be extra cautious if you suspect a spinal injury. Try to avoid moving the person as much as possible. Every accident is unique, but staying calm, acting quickly, and knowing these basic first aid steps can save lives. Keep your first aid knowledge up to date and carry a first aid kit in your vehicle at all times. By being prepared, you can make a critical difference when it matters most. Thank you for watching, and remember, safety first, always. Please subscribe to watch more health-related videos.